So you or someone you love just got a diagnosis, polymyalgia rheumatica, or PMR for short. And yeah, it can feel like a lot to take in. So in this explainer, we're going to break it all down for you. Let's start right at the beginning, with that feeling that so many people describe. Does that hit close to home? For a lot of folks, PMR isn't something that creeps up on you. It's bam, a sudden, really dramatic change. One day you're fine, the next you wake up and you're so stiff and sore, you feel like you've aged 20 years overnight, especially in those shoulders and hips, right? If that sounds like your story, you're in the right place. Let's dig into what's actually going on. All right, first things first. Let's put a name to these mystery aches. What is polymyalgia rheumatoida? Okay, the big word to remember here is inflammatory. This isn't your run-of-the-mill muscle soreness from overdoing it. PMR is what happens when your own immune system kind of goes haywire and starts causing inflammation in and around your joints. And that is what triggers all that pain and stiffness, hitting those big muscle groups the hardest. We're talking your shoulders and what doctors call the hip girdle, which is basically that whole area around your hips, thighs, and butt. And you'll notice it's not just the pain, right? It's a whole package of symptoms. The biggest one is that morning stiffness. I mean, it can be so intense, it makes just getting out of bed feel like a huge challenge. And on top of that, you often get these, constitutional symptoms is the medical term. But really, it just means you feel lousy all over. Kind of like you have the flu. You're tired, maybe you have a little fever, and you just don't feel like eating. Okay, so you've got all these symptoms. How does your doctor figure out that it's actually PMR? Well, it's not just one single test. It's more like putting together the pieces of a puzzle. It really comes down to 4 main steps. First, and this is super important, is your story. You telling your doctor exactly what you're feeling, especially that sudden start. Then they'll do a physical exam, checking for soreness and how well you can move. After that comes the blood work to hunt for signs of inflammation. And then there's a final clue, which is pretty unique to PMR, how you react once you start treatment. So about those blood tests, your doctor's probably going to mention 2 things, ESR and CRP. Don't worry about the long names. Just think of them as inflammation detectors. When PMR is active, these numbers are usually, they're sky high. It's a really clear signal to your doctor that something big and inflammatory is going on inside your body. Now, while they're piecing this all together, your doctor has to rule something else out. It's a very important question they have to ask. Could this be a related and much more serious condition called giant cell arteritis, or GCA for short? And here you can see the key differences. PMR is all about those big muscles in your shoulders and hips. GCA, on the other hand, has very specific warning signs. We're talking about a new kind of headache, your scalp feeling tender to the touch, pain in your jaw when you chew, or any changes in your vision. And listen, this part is absolutely critical. If you have any of those GCA symptoms, it's a medical emergency. You need to call your doctor right away, immediately. All right, so once the diagnosis is confirmed and GCA is ruled out, we can talk about treatment. And this is where the really good news comes in. The first step usually brings relief, and it brings it fast. The number 1 treatment, the gold standard for PMR, is a low dose of a steroid medication. You'll probably hear the name prednisone. It's an incredibly powerful anti-inflammatory. It basically tells your immune system to calm down, and it works very, very quickly to bring down those symptoms. This quote really captures it perfectly. The response is brisk and complete. What does that mean? It means it works so well and so fast that it's actually part of the diagnosis. Seriously, so many people go from feeling awful to dramatically better in just a day or 2. That incredible turnaround is a classic sign that it's PMR. Okay, so you're starting to feel human again, which is amazing. But it's important to know that this is the beginning of the journey, not the end. Getting that initial relief is step 1. Step 2 is learning how to manage the treatment for the long haul. And that brings us to something called tapering. You can see a sample of it here. The thing about steroids is, while they're amazing, they can have side effects if you're on them for a long time at a high dose. So the goal is to not stay on that starting dose. Your doctor will work with you to slowly, and I mean very slowly, lower your dose over months, sometimes even a year or 2. It's all about finding that sweet spot, right? The absolute lowest dose that keeps your symptoms away while also cutting down the risk of side effects. This is a real partnership between you and your doctor, a balancing act you'll manage together. Now, as you start to lower that dose, just know that it might not be a perfectly smooth ride. In fact, it's really common to hit a bump in the road. We're talking more than half of all patients. And that bump in the road is called a relapse or a flare. And I want you to hear this loud and clear. This is totally normal. It's not a setback, and it definitely doesn't mean you've done anything wrong. It just means the dose went down a little too fast for your body. Your doctor will just bump it back up a little to get things under control, and then you'll continue the taper, maybe just a little more slowly this time. All right, so let's look ahead. We've talked about diagnosis and treatment. What does the future look like? I know the journey can seem long, but the overall outlook is really, really positive. And here's something that I hope brings a huge sigh of relief. Unlike other conditions you might have heard of, like rheumatoid arthritis, PMR is not erosive. That means it doesn't cause permanent damage to your joints. The pain and stiffness, that's all from the inflammation. Once you get that under control, there's typically no lasting harm done. That's huge. So living well with PMR is all about being in the driver's seat of your own health. You want to talk to your doctor about protecting your bones. That's a common side effect of steroids, so ask about calcium and vitamin D. Keep moving gently to manage stiffness, and just keep those lines of communication open with your doctor. And of course, always, always keep an eye out for any of those GCA symptoms we talked about. And the good news just keeps coming. For people who really struggle to lower their steroid dose or who have a lot of flares, there are newer options. They're called steroid-sparing medications. A name you might hear is sarilumab. These drugs tackle the inflammation from a different angle, giving people another fantastic tool to get PMR under control. So, when you boil it all down, a PMR diagnosis isn't a destination. It's the start of a journey. Yeah, there will be ups and downs for sure, but it is absolutely a manageable one. The more you understand it, the more you work as a team with your doctor, and the more active you are in your own care, you've got this. You can navigate this path. So the only real question left is, what's your next step going to be?